The ninth meeting of the Committee of the Ministers of Health in the Gulf Cooperation Council discussed in Muscat a number of topics on promoting cooperation in health to improve quality of health services in the GCC countries. His Excellency Dr. Hilal bin Ali Al-Sabti chaired the meeting. In his welcoming speech, he emphasized that the meeting is part of the GCC endeavors towards promoting cooperation in health to improve the provision of health services to the level of excellence, while keeping up with the rapid progress in technology, artificial intelligence, Internet of Things, and promote joint action process to develop the system of this vital sector in the Gulf countries. His Excellency Jassim Mohammed Al-Budaiwi, Secretary General of the Cooperation Council for the Arab States of the Gulf, in his speech, he said the considerable attention that Their Majesties and Highnesses, the GCC leaders, have paid to health and their assertion to the need for continued work to achieve the aspirations of the GCC people.
The agenda of the Minister of Health of the Gulf Cooperation Council was a very rich agenda, very useful and needed agenda. Many important items were discussed. The most important item that was agreed upon, actually two most important items, was a follow-up on the recommendations by Their Highnesses, the leaders of the Gulf countries in their last summit in Riyadh in 2022 on the public health issues and the cooperation, the Gulf cooperation on public health. This one item. The other item was also agreeing on an initiative that was proposed by the Gulf Cooperation Council Secretariat, General Secretariat, to establish a virtual public health, Gulf public health institution.
The ninth meeting of the Committee of the Gulf Health Ministers session approved the agenda of the meeting and endorsed a number of draft resolutions submitted from Health Under-Secretaries Committee. During the meeting, the Saudi Ministry of Health proposal on recognizing March 2nd of every year as the World Health Monetary Day was reviewed. Furthermore, the meeting addressed the Sultanate of Oman proposal on activating telemedicine clinics for rare specialties among Gulf countries. The proposal aspires to create a joint electronic platform for all GCC countries on clinical consultancy so that rare specialties physicians can discuss and follow up rare medical cases of various congenital anomalies in newborns of children and types of cancers that are rare or unresponsive to treatment and others. The health ministers in their ninth meeting here are determined to come out with the best methods of strengthening the health cooperation, at the same time upgrading coordination between the health ministries of the GCC countries to improve the level of efficiency of health systems and enable the peoples of the GCC countries to access quality health services. Abdallah bin Ahmed Rubaiey, Sultanate of Oman Television, Muscat.